CataractCoach.com. Newbie resident cataract surgery. We're going to watch a junior resident doing case number 8. What's good and what needs improvement? So starting off the case with a good paracentesis there. Looks like it's going to be a right-handed surgeon. Trypan blue dye is being used to help increase the visualization. Even though there was a good red reflex, sometimes putting trypan blue dye for a junior resident does help a lot. Also, there's an added benefit. Trypan blue dye makes the lens capsule a little bit less elastic, so maybe less likely to run out. There's some anesthetic going in the eye. And now time for some Viscoelastic. We've sped up the video at 4 times normal speed. So the function here when you're doing case number 8 is not speed, it's not even efficiency, it's safety and learning. Making sure you're getting better every case. So this is case number 8, and let's see what the main incision looks like. Here's the keratome, and then starting off there, fixating that with forceps. That was a reasonable incision, I'll take that. A little bit of nicking of the limbal vessels. Now we've got a few eyelashes sticking out, that's not great. So the draping could definitely use some improvement here. We don't want to have eyelashes on our surgical field. Starting with a cystotome, I'm going to do a little bit better job of centering up the eye. That looks good. And here starts the rhexis. That looks great. Hey, for case number 8, we'll take it. This is pretty good. Now, I hope the patients received a retrobulbar block because at case number 8, you don't need to have the patient sit through a topical case. That's just not going to be comfortable for anyone. Better off doing a retrobulbar block or subtenos block. And we have great videos of that on CataractCoach.com. The rhexis looks fantastic. Great job of floating in the incision. No distortion of the incision. That's actually quite remarkable for case number 8. So that looks great. Taking that out. Looks like about a 5mm capsulorhexis. Excellent. So now some balanced salt solution for some hydrodissection. So here using a specialized bent cannula under the rhexis edge. There's some good fluid waves. This is pretty good. If this is case number 8, I'm pretty impressed. And so now, I don't know if the nucleus was rotated enough. Does it spin? But looks like the surgeon's preparing the phaco probe, adjusting the sleeve tip. And it's important here to adjust the sleeve tip to suit your method of surgery. Now going in here, bevel up, and looks like a groove down the middle. And then as we know, this groove should be a little bit deeper in the center and a little bit shallower in the periphery. And that's a pretty good groove, nice and wide groove, sufficiently wide. A little bit deeper just in the center. And let's keep watching. That looks a little bit deeper. That looks great. Now the key here is to get it just deep enough. You don't want to be so deep that you're risking damaging the posterior capsule. And if you're so anterior and not too shallow, then you'll have a very difficult time of splitting the nucleus. And so that looks pretty sufficient to me there. If you look down in the middle of that groove, it looks like there's a very nice beginning of a red reflex there. So a little bit of a break here. Phaco probe came out of the eye. Okay, it goes back in the eye. And then now, so I'm using a paddle on the second hand. That paddle can be sometimes more effective than a chopper because it has more surface area and it's able to go and separate the pieces without having a sharper, smaller tip dig into the pieces. So divide and conquer technique here, now splitting into quadrants. That looks great. And this surgeon has really done practice in a wet lab. This is amazing for case number 8. If this is truly a junior surgeon doing it on his or her own, this is pretty impressive. So 4-quadrant divide and conquer. The first quadrant now is coming up out of the capsular bag. That looks great. Using the spatula in the second hand to help bring things centrally. And you'll notice the phaco probe's in a good position. The eye staying in primary pretty much. And the nuclear pieces being brought up to that iris plane for emulsifying. This is great. This is a resident who has been studying Cataract Coach videos. Not just watching, studying Cataract Coach videos. That was fantastic. So this surgeon will certainly blossom into an accomplished cataract expert. It'll just take time. Little cortex removal. Let's see the technique here. Looks pretty good. Nice circumferential pulling. A little bit of radial tugging. Looking good. Now be careful. If you're the surgeon who sent this video and we kept you anonymous, say thank you for the praise because you've done a lot of things well here, but just understand the lack of experience with doing so few cases means that you're very early in the learning curve. And make sure you still are your own toughest critic. Strive to be better and better every case. If this is your case number 8, you can be a world-class surgeon. Just give it 1,000 cases. Be patient enough. Here comes the IOL. Let's see what we got here. Delivering it very nicely. Eye stayed in primary. Lens is opening up very well in the capsular bag. Wow, time to finish up the case. Fantastic case. Great job. You're well on your way to becoming a cataract expert, even though you've just done 8 cases, or maybe with this, you're already at 10 or 20. But keep up the good work and be your own toughest critic. I accept the praise, but don't kind of rest on it. Also, be sure you check out cataractcoach.com. You can submit your video. We'd love to learn from you. You can also sign up for a free daily email, and we'll deliver you a great bit of learning, just like this case, right to your inbox. So congratulations, newbie surgeon. Welcome to the club of cataract surgeons, and keep up the good work.